Welcome to session 5. In this session, we're going to talk about non state actors, basically international non governmental organizations or NGOs, businesses, corporations, and foundations, and the role they play in global health and how they support the UN and other organizations in basically aligning with global health priorities. The primary types of actors in the global health systems consist of national governments and organizations or organs within the United Nations systems, multilateral development banks. In this session, we're going to talk about the other non state actors, which include global health initiatives or hybrids, philanthropic organizations, specifically foundations, global and local non governmental organizations, including civil society organizations, private sector organizations, professional organizations and associations, and academic institutions. So, a simple question can be asked: where does the sources of funding for the non state actors come from? Well, they come from various sources. They come from multilateral donors, including the World Bank or the IMF, which stands for the International Monetary Funds. They come from regional development banks, which we will discuss. They come from bilateral donors, predominantly the OECD, which is the Organization for Economic Cooperation and Development. The OECD was founded in 1961 to stimulate economic progress and world trade and consists of basically 38 member countries. They also come from foundations. This can be either individual foundations or corporate foundations. Much of the money also comes from businesses and also from recipient countries. Financing for non state actors come from the World Bank Group. Listing from this slide include the World Bank Group, which consists of basically five different entities: the International Bank of Reconstruction and Development, IBRD, the International Development Association, the International Finance Corporation, the International Investment Guarantee Agency, and the International Center for Settlement of Investment Disputes. And you can see here the various functions that these different banks have and corporations have. There's also the International Monetary Funds, which promotes international monetary cooperation and facilitate international trade, fosters sustainable economic growth to reduce poverty around the world, and makes resources available to members experiencing balance of payment difficulties. And then there are various regional development banks, and we will talk about the regional development banks. There is some criticism in terms of the international development banks, the IMF, and their policies that they have invoked in terms of how they lend their money specifically to low and middle income countries. And sometimes these policies have seemed to be biased and unfair to low and middle income countries, specifically in terms of not allowing those particular low and middle income countries to show autonomy in terms of supporting sometimes governments that have been shown to be less than politically, we would say, less than democratic in terms of the way they use their money and have been oppressive to their regimes. This slide also shows, in terms of the World Bank Group, the specific function of each of the World Bank groups and their locations. As you can see, the World Bank Group are all founded and located in Washington, D.C. Although they lend their money in low and middle income countries, none of these banks actually are located in low and middle income countries, which begs to differ. If you are supposed to lend your money to institutions or to individuals in low and middle income countries, why are you not located in in areas in which you're supposed to do most of your lending. So there is a significant bias which many see in terms of the fact that the individuals that run these institutions are not really located in where they are supposed to be working in. So, for example, many banks, if there is a bank that's supposed to lend its money to farmers and it's not located in a rural area, how can the bank understand how farmers are supposed to operate and understand the conditions and make wise monetary decisions? So this is akin to that sort of situation. The situation with the regional development banks are a little bit different. As you can see, here are a listing of the different regional development banks, and the location of the regional development banks are different because they are actually located in the different regional development banks. For example, the African Development Bank is located in Abuja. The Islamic Development Bank is located in Jeddah, and so forth and so on, including the Latin Development Bank is located in Caracas. So this makes for a sort of different situation in most of the cases in terms of the regional development bank. But in some cases, the regional development banks still have some of the very onerous lending conditions and specific situations that exist that it does not allow it to lend as freely as it could or that it should in some cases, so that it makes it a little bit more difficult for individuals to access the capital market based on its lending standards. There is criticism of some of the lending practices of the World Bank. However, in 2020, the World Bank committed 8.13 billion to health projects, more than the WHO and the Gates Foundation. Its main priorities included pandemic preparedness, nutrition, reproductive, maternal, newborn, child, and adolescent health, infectious disease and vaccination, and also universal health coverage. This image shows the World Bank health projects that were supported, which has been updated for 2021. In terms of the projects that were supported, the World Banks basically supported health systems where the majority of what it funded. Next was population health and reproduction, followed by child health, followed by rural services and infrastructure, then participation in civil engagement, then public health expenditure, and then education for all. Those were the primary areas of focus that were funded in terms of projects by the World Bank. So we can look at philanthropic contributions by sector. And in fact, this article looks at the 10 largest public and private philanthropic funders of health research in the global space, and they're divided into different areas based on country. Table 1 shows just 18 of actually the 55 major public and philanthropic funders listed in this publication. As you can see, of the 18, number 1 is the National Institutes of Health, which is actually a branch or an agency within the United States government. Of the private foundations listed on Table 1 from the U.S., you have the Howard Hughes Medical Institute, which is listed at number 9, which is a large philanthropic organization. And then next on the list, which is based in the U.S., is the Bill and Melinda Gates Foundation. Bill and Melinda Gates Foundation is one of the largest foundations, which it was actually started in the year 2000, which funds significant amounts of global health in terms of its work. Even though Howard Hughes does fund a lot of work, it's mostly focused in domestic in terms of a lot of his work and some in the global domain. So this shows you the amount of different philanthropic and public entities that do a lot of funding in the global health domain. I encourage you to actually look at this particular article, to read it, to get a better grasp of which are the major public and philanthropic funders in the global health space. So, some of the foundations supporting global health, of course, one of the biggest foundations that you're very familiar with is, of course, the Bill and Melinda Gates Foundation. I think, given the current state of the fact that both Bill and Melinda Gates have filed for divorce, we don't know the current state of how that foundation will function within the next few years, but we do know that currently it is the biggest foundation in the global health space. The Open Society, also the Ford Foundation, the William and Flora Hewitt Foundation, also known as the Hewitt Foundation, the Children's Investment Fund, the United Nations Foundation, the MacArthur Foundation, and so forth and so on, have found are other foundations that have significantly supported global health. Uh, it is noteworthy to talk about the Bill and Melinda Gates Foundation because they are such a huge foundation. They were founded in 2000 and its work is in over 130 countries, and it is a very large foundation. As you can see from this pie chart, the majority of its work is in global development and global health, followed by, of course, growth and opportunity, United States programs, global policy, and other charitable um, programs. But of course, that changed after COVID, and a lot of its programming went to COVID and vaccination preparation. This is a closer look of its global health portfolio based on disease. As you can see, 16% is on HIV, with 15% being on malaria, 10% being on maternal newborn, child health discovery tools, 9% on tuberculosis and pneumonia, 8% on discovery and translational sciences, 7% on tropical disease, and 7% on vaccine development. I would imagine that that area has significantly increased because, again, this was 2018 data. We are in 2021, and I think that COVID-19 has expanded its portfolio because of its interest in vaccine development and its support of Gavi. Globally, we can look at the giving of foundations. And in fact, the OECD has published some data, and this is a relatively sampling of data, looking at both domestic giving and cross-border giving. And it has looked at foundation giving. And as you can see, basically most foundations in emerging economies, most of the giving tends to be more domestically associated. So foundations in emerging economies tend to give domestically, with a small part going cross-border or going to other countries. One exception is, of course, with the United Arab Emirates, which tends to give outside of its borders. But looking at the example of Mexico, Turkey, Brazil, India, and of course China, most of the giving from these countries tend to be more domestic and less cross-border. So there are some positives to foundation givings. Um, the one, the three positive things that we can say about foundation givings is outside of government spending is that increases the diversity of funding sources available for global health issues, and it fills in the gaps that governments are unable or are unwilling to address specifically for certain issues. Foundation giving can also direct attention toward neglected aspects of the global health agenda, and it can spur innovation and offer unique tools for encouraging new approaches to advancing the global health agenda. Unfortunately, there are some criticisms in terms of foundation giving. And one of the major criticisms for foundations, unlike governments, is that foundations are that when they give, they lack of accountability of measures. So, foundations, for example, Bill and Melinda Gates, are accountable to nobody. At least governments are accountable to their people, but foundations are basically accountable to nobody. In that case, they might employ inappropriate solutions and technologies that ignore local needs and capabilities. Because again, they're not really accountable to anybody. They add their money in and they can pull up their stakes and leave at any time. They have they might have a technological biomedical bias that may be inappropriate in certain contexts. So these might be associated with foundations that are associated with companies. So they might have a certain bias to push a certain type of technology, which might not be inappropriate. And they can be overtly dominant, even crowding out other voices. And that means local voices, right? So they might crowd out a local voice, which might have a more simple solution, but then the foundation money might say, this is what we're going to do, instead of utilizing a more simple solution. So these are very significant criticisms, which again, the foundation money can significantly impede those local voices. Similar to foundations, NGOs or non governmental organizations also have a voice. Now, non governmental organizations can be smaller, they can provide public education, they can also can provide a way to debate issues, can provide transparency, which some foundations might not necessarily be able to provide. They can provide accountability for both governments and foundations and other non state actors, and they can provide legitimacy. This data is meant to show that over the years, the number of non governmental organizations has changed and has continued to increase and will also continue to increase. So, in terms of compared to 1948, um, non governmental organizations that were associated or recognized by the UN has increased, and in 2010, there were over 3,000. Now, this is 2021. I don't have the latest figures, but I think that it's more than 3,300 at this point. The Urban Institute published a report in 2013 looking at the expenditure and expense of reporting for public charities as reported by the Internal Revenue Service for the United States. It showed that actually 66.4% of the charities reported less than $500,000 within the United States. That would be these two groups right here in actuality. And in fact, these two groups were actually small. But if we looked at the bigger charity groups, only 5.3% of those reported expenditures of 10 million or more. And these groups actually accounted for 86.7% of the total public health expenditure of public charities within the United States. Moreover, the Urban Institute found that the majority of charitable reporting or the reporting for public charities revenue sources contain fee for services and goods from public services or fees for services and goods from government sources. The minority of charitable reporting from public charities were from private contributions or government grants, and a very small minority were from investment income, about 4.8%, and about only 2% were from other income. Within the US, there are mega NGOs. These are the listing of the mega NGOs that work with the US government to really deliver goods and services, implement various programs working with government partners, including USAID, the State Department, the CDC, and various government entities. And you might be familiar with some of these names, but they work in not only within the United States, but within various low and middle income countries around the globe. OECD and other organizations have looked at how philanthropies and foundations basically partner with civil societies, and they partner through a variety of mechanisms. The main way that they partner is via basically NGOs and civil societies, universities, multilateral organizations via partner countries. Also with private sector, public-private partnership, 4%, and other channels. But the main channels are here, which you can see as in NGOs, civil societies, universities, and multilateral organizations, and some for-profit sectors, and of course, private partnerships. The partnership element of non-state actors is important because when we look at the Sustainable Development Goals as dictated by the UN, Goal 17, Partnerships for the Goals, basically is covered in this element right here. In summation, Goal 17 basically says strengthen the means of implementation and revitalize the global partnership of sustainable development. Mobilize additional financial resources for developing countries from multiple sources. Encourage and promote effective public, private, and civil society partnership, which recognizes the need for specifically non state actors, NGOs, private sector, public sector partnership to move things forward. And not only UN and government, but understands that there needs to be a whole host of individuals to really move the goals of the Sustainable Development Goals and development forward. This concept of multi-sectorial partnership involving both UN and non-state actors is embodied in the 10 principles, and this 10 principles covers basically 4 pillars: human rights, which we talked about before, labor, environment, and anti-corruption. I'm not going to go through all of these 10 principles, but as you can see how these 10 principles really encompass the need to have multi-sectorial partnerships in order to really move things forward. And it really relies on business as a global and necessary partnership to move these things forward. When we think about developing a health-focused public-private partnership in order to achieve our goals, the partnership components need to be aligned. We have to have effective policies, defined strategies, and then intermediary platforms. Those partnership components need to begin with the country health and development priorities. So this has to be a bottom-up approach. We need to also identify the opportunity based on the alignment of the country priorities and business interests. We need to build the programmatic approach and monitor the accountability and impact. This provides the enabling environment in which we can have the framework to move forward. This together is the framework that is proposed to allow for the development of a public-private partnership, and this is how we build trust in order to move forward and achieve our goals. For the aforementioned framework to work, non-state actors are NGOs, private sector entities, philanthropic foundations, and academic institutions. And any engagement must, number one, demonstrate a clear benefit to public health. It must also conform with the WHO's constitution and mandate the general program of work. Respect the intergovernmental nature of WHO and the decision-making authority of the member states. Support and enhance without compromising the scientific and evidence-based approach that underpins the WHO work. Protect the WHO from any undue influence, in particular on the processes in setting and applying policies, norms, and standards. Not compromise WHO's integrity, independence, credibility, and reputation. Be effectively managed, including by avoiding conflict of interest and other forms of risk to WHO. And finally, be conducted on the basis of transparency, openness, inclusiveness, accountability, integrity, and mutual respect. Within that framework, the role of the ministries of health at the country level includes policy making, working with the country level for financing and standard setting and regulation. It also includes collecting and disseminating information, research support and training, technical assistance working with WHO, and direct management. Ultimately, we must acknowledge the Ministry of Health's role in autonomy in setting up the framework, because ultimately it's the Ministries of Health's role in terms of reporting to the Prime Minister at the country level, its reporting duties to the Parliament in terms of the country level, its role in other ministries in terms of providing guidance, its leverage, its relationship with other non-state actors within the country, its regional organization role in terms of policy, and its role in terms of working with other UN organizations. So it is within this sort of framework in which we must understand that non-state actors have a major role to play, but the Ministry of Health has a major role to play in terms of its role, in terms of working with non-state actors to implement evidence-based interventions at the country level. And we must enable it and work with it to make sure that it has and will implement those evidence-based interventions in that particular setting.